So, continuing our discussion about the kidney problem, the commonest cause for kidney failure is diabetes. Diabetes contributes about 50% of the all kidney failure are because of the 40 to 50% are because of the diabetes mellitus. This diabetic people over a period of 10 to 20 years, they start developing high blood pressure. They start passing protein in the urine. Then finally the blood pressure and the creatinine levels start increasing. By the year 20 years, they'll end up in renal failure. So this is the commonest cause right now all over the world. For this, we have to control the two things. One, to prevent this patient going into renal failure, first of all, you should bring down the blood pressure into target range. Target blood pressure is 130 by 80 millimeter of mercury. And for that, the medicines what we are using, we should compulsorily use the group of medicine called angiotensin converting enzyme inhibitor or angiotensin receptor blockade. These are the medications which are used to reduce the diabetic patient landing in renal failure for the last 3 decades. Now recently we have excellent medication that has come which can reduce the incidence of renal complications as well as reduce the complications, the cardiac complications. These are all called the SGLT2 inhibitors, sodium glucose cotransport inhibitor. They reduces the proteinuria, they reduce the blood pressure, they reduce the uric acid excretion, they increases the salt and water excretion. All this way, they reduce the people landing in renal failure by about 40% of the people are prevented from landing in renal failure. Apart from SGLT2 inhibitor, there is another group of GLP-1 receptor antagonist. That is glucagon-like peptide receptor 1 antagonist. These sort of drugs also have, like SGLT2 inhibitors, cardiac protection, renal protection. This is the second important drug which has come to our armamentarium last few years. And third one, recently in months, been approved by the United States FDA, that is called the mineralocorticoid receptor antagonist. In this, there is many drugs are there, spironolactone, the eplerenone, there. Now there is a finerenone is a drug which is called the non-steroidal MRA, mineralocorticoid receptor antagonist. This is called, apart from reducing the blood pressure, it reduces the incidence of renal failure, incidence of cardiac complication. All these things are there. These are the 3 weapons we have recently, last 3-4 years we are having it with us. And now I hope in future the load of CKD because of the diabetes may come down with the use of these medications. The causes of the various renal manifestations of diabetes is because of one is because of diabetic kidney disease, another one is a non-diabetic kidney disease, third one is recurrent urinary tract infection, and fourth one is emphysematous pyelonephritis, and fifth one is increased frequency of renal stone disease. These are the problems, renal problems that occurs more frequently in diabetic individuals, apart from the DKD, diabetic kidney disease. Diabetic kidney disease is one that got a protein excretion will be more. It will be in grams, about 10 grams, 20 grams or 30 grams like this. And blood pressure will go out of control. All these are controlled with the medications. And the treatment of diabetic kidney disease is tight control of glycemic control to bring down the HbA1c by 7. Tight control of blood pressure to keep the target blood pressure by 130 by 80, number 2. Number 3, protein restriction to bring down the protein intake by 0.6 to 0.8 grams per kg body weight. Number 4, salt restriction by restricting the salt to about 3 to 5 grams per day. Number 5, And then in addition to fluid restriction, all these are the various treatment modalities. In addition to that, blood pressure should be brought to the target range by using ACE and ARB. In addition to that, as I said, the SGLT2 inhibitors, GLP-1 receptor antagonist, as well as the MRA, mineralocorticoid receptor antagonist, like the non-steroidal mineralocorticoid receptor antagonist like finerenone. These are the drugs which can be used to prevent the diabetic patient landing up the renal failure and to prevent the diabetic patient getting into cardiac complications. Thank you.